Good afternoon.
Good afternoon.
This is Reshma Karthika, and I am the educator for your OET Speaking Subtest held at Tiju Academy on November 15th. So, the candidate's name is Varsha Mohan, and the candidate's number 10135. Can I have your ID, please?
Sure.
Thank you, Varsha. So, Varsha, we will be beginning the session with some warm up questions. This is just to get familiarized with each other's voices. Would that be fine?
Yes.
Okay. So, Varsha, what is your professional background?
Well, ma'am, I have just completed my graduation in nursing and I'm a nurse by profession. I have 6 months of experience as a nursing trainee during the course of my studies. Right now, I'm looking for a platform to upgrade my skills and knowledge.
All right. So, please describe your typical day at work.
Well, ma'am, we have different shifts in our duties. I'm just going to explain the morning shift to you. So, at first, I start my day with a small prayer. After completing my daily routine, I go to my workstation. I reach my workstation around 7 a.m. After reaching there, I check the inventories and update the crash card. Then I take the handover from the previous duty staff. And after that, I just go to the patient bedside, do the needful for them, and meanwhile, I assist the physician also. In between, I take some time to interact with my colleagues at the same time. And after that, I document everything, whatever I did for the day, and give the handover to the next duty staff and leave the ward.
Okay. So, now tell me what all are the current trends in your profession, which is nursing profession?
So, nursing is a dynamic profession. Changes are happening on a daily basis to mention. So, we do have different trends right now. So, to mention a few, first of all, we are following evidence based practices, which means every procedure has got a scientific rationale. And other than that, nurses can these days work as a nurse practitioner, which is equivalent to the position of a physician. Initially, we used to follow a paper based documentation technique, but these days, everything has been digitalized and we are doing electronic based documentations. So, these are current trends in our profession.
Okay, thank you, Varsha. That's all about the warm up session. So, now you can start with the role play card. Here is your role play card. So, we'll be having 3 minutes for preparation and 5 minutes for conversation.
So, how may I address the patient during the conversation?
You can call me Jenny.
Thank you.
Your time is up.
Okay.
So, now you can proceed with the role play card.
All right. So, good afternoon, Jenny.
Good afternoon, nurse.
Let me remind you once again. My name is Varsha and I'm the assigned nurse for you today. And the purpose of my visit here is to remove your stitches, do the wound cleaning and redressing. So before we proceed into that, I just need to know, do you have any specific concerns? How are you feeling at the moment?
Well, nurse, the doctor told me that I have something called Squamous Cell Carcinoma, which I think it's another name for skin cancer. And I'm worried.
Well, Jenny, being in your position, I can understand how you might be feeling at the moment. You don't have to worry. I will give you information on this. And what you have told me is partially correct. Let me add on to it. So, actually, the squamous cell carcinoma is a type of skin cancer which is basically caused by sun exposure or ultraviolet radiation. But after hearing all these terms, you don't have to be concerned because we all are there. We are taking care of you and we are well expertise in this field also. And to add on, let me tell you that the surgery is quite effective. So, the lesion is removed from your hands and the cancer is very unlikely to spread. So you don't have to worry about anything. Please relax yourself. Furthermore, let me give you one advice from my side. It is regarding the skin monitoring. Can I proceed with the same?
Yes, nurse.
Okay. So do check for any changing or any new spores coming into your body. Other than that, do have regular checkup with your GP. So will you be able to do the same?
Yes, nurse.
Well, Jenny, good to hear that. At the same time, can I just know if you need any further clarification from my side?
Well, nurse, I got a better understanding about what is squamous cell carcinoma now. But I would like to know if I need more surgeries in future to remove these lesions.
Well, Jenny, that's a valid concern from your side, but I'm so sorry to say that I'm not the right person to give you information on this because this is beyond my scope of practice and the doctor is the right person. So please have a word with the doctor. I will convey the same to him also. So will that be fine?
Yes, nurse.
Okay. Along with this, I just need to know about your habits when in sun. So do you use any sunscreen or any hats?
Yes, nurse. I always use a sunscreen, especially a high factor sunscreen, 30 or higher. And I always use a hat when I'm out in the sun. But I think the damage has already done because I had spent a lot of time in sun during my teenage years.
Well, Jenny, thank you for your response. And what you have raised is a genuine concern. But let me tell you that it is really important for you to do the ongoing prevention. So I request you to please continue to cover up when in sun because this will help in the prevention of further damage to your skin. So make sure that you're following the advice that I've given right now. Along with this, I just need to know about your wound post surgery, that is after surgery. So, is there any pain or discharge that you have noticed?
Yes, nurse. I'll make sure I'll look after my skin from now. And the wound has been fine, there is no pain, no discharge, but still, I think it's too early to remove the stitches.
Well, Jenny, first of all, I'm really happy to hear that your wound is healing really well. There is no pain or discharge. That's a good sign. And to address your concern, I can give the reasons for the removal of the stitches right now. It is because the wound is healing well. As per the assessment by the doctor, they have told us that it is healing good. And these stitches are typically removed after 7 to 14 days of time. So you don't have to be concerned about the stitches removal. To add on to this, let me give you some advice regarding the aftercare. So are you willing to listen to the same?
Yes, nurse.
All right. So, Jenny, there is something which you need to keep in mind regarding the wound. So, please keep the wound clean, dry, and also covered. So, these are certain instructions which you need to follow. So, if I have clarified all your doubts, can I just have your consent to remove the stitches now?
Yes, nurse, I'm ready to have the stitches removed.
All right, thank you for the consent. I'll proceed with the stitches removal, but before that, so as to give you much more clarity on what is this condition squamous cell carcinoma, I would like to brief in our discussion once again. Can I proceed with the same?
Yes, nurse.
Okay. So first of all, you were concerned about squamous cell carcinoma. I gave you an information regarding what this condition is. To add on to your information, I told you that it is a type of skin cancer which is caused by sun exposure or ultraviolet radiation. Furthermore, to your anxiety relief, I told you about the effectiveness of the surgery. So the surgery is done and the lesion is removed now. So the cancer is unlikely to spread. Also, I told you the importance of your skin monitoring. That is, checking for any new or changing spots and regular contact with the GP also to check any further instructions given by them. And also, I clarified your doubt regarding the further surgery. That is, I'm not the right person to give you information on that.
Your time is up. Thank you, Varsha.
Thank you.